like to do today is tell you about a really unusual hospital where I practice medicine, which is the reason I'm here. And the name of the hospital is Laguna Honda Hospital in San Francisco. And it was like no hospital I'd ever seen or even imagined. And I got there kind of accidentally. I'd been practicing medicine for several years, and I decided to go back to graduate school and get a Ph.D. in medical history. And it was the only place that would let me practice medicine part-time. So I went over for my interview, and when I saw it for the first time, high on a hill, I was surprised. It looked like a medieval monastery. It had cream-colored walls and a red-tiled roof and a bell tower and turrets. And after my interview, the medical director took me out for the tour. The hospital was huge. It was on 62 acres of land in the middle of San Francisco, and it had 1,178 patients. And she explained that it originally had been called the San Francisco Almshouse, which is how we used to take care of the sick poor before there was health insurance. And it used to be that almost every county in the country had an almshouse. And then in the 1950s, they all started to be closed for reasons of justice from the left and economics from the right. And Laguna Honda was probably, she thought, the last almshouse in the country. Then we walked around and she showed me the old-fashioned long open wards for the patients, the 1950s era beauty salon with its steel helmet hairdryers, the chapel, which looked more like a small church with polished wooden pews and real stained glass, the stations of the cross along the walls. And then we went outside, and she showed me the greenhouse, the aviary, and the barnyard. And then we walked back to her office, and she offered me the job. I didn't know. I wasn't sure. So I told her I would come for 2 months, and I stayed for more than 20 years. Mostly because of the patients, who were wild. They were 2 standard deviations from the mean. Any mean. So they were the tallest and the shortest, and the fattest and the thinnest, and the nicest and the meanest patients I ever had. And they had almost every disease. So I learned a tremendous amount of medicine there. But if I had to sum it up in one sentence, it would be that medicine is personal, face to face. And when it's personal, it works. This gelled for me the day I met my friend, Dr. Curtis, who was coming back from outside the hospital to go back to see a patient who'd been there for months. And he told me that this patient had been ready for discharge, but every time he came to see him, he was zipping around in his wheelchair and still going to therapy. So finally, Dr. Curtis told me, he asked the patient, "Why, since you're able to walk, haven't you been discharged?" "No shoes, doc. They've ordered me special shoes, but they're waiting for Medicaid to approve them." "How long have they been waiting?" Dr. Curtis asked. 3 months. Dr. Curtis thought about that, and he asked the patient, "What size shoe do you wear?" "Size 9. So Dr. Curtis thought about the patients he had to see, the charts he had to write, the forms he had to fill out, and then he went over to Walmart and bought a pair of size 9 running shoes for $16.99. And now he was coming back to put them on the patient and write the discharge orders. Was he going to submit his receipt for reimbursement, I asked. He laughed. He reminded me of an aphorism I'd always loved but had never understood. The secret in the care of the patient is in caring for the patient. I'd always thought that that meant caring about a patient, loving or at least liking a patient. But when I watched Dr. Curtis rush off to put shoes on a patient he hardly knew, I looked it up, and I found it in a talk by Dr. Francis Peabody to the graduating medical class of Harvard in 1927. Turned out what Dr. Peabody said was that the secret in the care of the patient is not caring about a patient, but caring for a patient. And by that he meant doing the little personal things that nurses usually do. Adjusting a patient's bedclothes or giving him sips of water. That wasn't, he admitted, the most efficient way for a doctor to spend his time, but it is what created the personal relationship between patient and doctor. And that relationship was the secret of healing. So what Dr. Peabody really was saying was that the secret of healing was inefficiency. It was particularly ironic because Laguna Honda had just hired a team of healthcare efficiency experts to come to the hospital, and if they'd known about Dr. Curtis and those shoes, I'm sure they would have thought it very inefficient. But when you think about it, it really was providing the most efficient health care of all. Reaching the right diagnosis, no shoes. Providing the right treatment, shoes. And all for the least amount of money, $16.99. I call this the efficiency of inefficiency. And it's what happens when medicine is personal. In the meantime, I'd gone back to school and was studying the work of Hildegard of Bingen, who was a remarkable woman who lived in the 12th century and who was a nun, an abbess, a visionary, a composer, and a medical practitioner. And very unusually for a woman, and a nun, she'd written a book about her medicine. And this book was fascinating because it wasn't the eye of newt, toe of frog medicine we expect from a medieval medical text. It was a real medicine for real patients with real diseases, but it was based on a completely different model of the body from our mechanical model. Hildegard's idea was that the body was more like a plant than a machine. What's the difference? The difference is that someone has to fix a broken machine, but a plant can heal itself. And Hildegard called the power of a plant to heal itself its greening power. It's verititos, from the Latin veritas, that means green. And she thought that the body had its own greening power, its own verititos, and that the job of a doctor was to nourish it and remove obstructions to it. But I didn't really understand what she meant until my patient, Terry Becker. Terry was homeless and lived on the streets with her boyfriend, Mike. And they smoked, drank, and took drugs. And then one day, Terry woke up paralyzed from the neck down. She went over to the county hospital and they diagnosed transverse myelitis, which is a very rare viral disease that has no treatment, but usually gets better over time. So they sent her to Laguna Honda, and she was my patient, and she did get better. But then the first of the month rolled around, which is when the homeless in San Francisco get their welfare cash. And Mike showed up with alcohol and drugs, and out they went, and Terry disappeared for about a year. During that year, she had 28 visits to the emergency room. And Mike even took a 2x4 to her once and broke her leg and robbed her and abandoned her on the streets. Eventually, she developed a huge bed sore from sitting in her wheelchair, and the doctors at the county hospital tried to cover it with a skin graft 3 times. But every time Mike showed up with alcohol and drugs, and out they went. And finally, that bed sore was too big to treat. It was too big to cover with a skin graft, and they sent her back to Laguna Honda. And when I saw that bed sore for the first time, I was absolutely shocked. It went from the middle of Terry's back to her tailbone, and it was so deep that at the bottom of it I could see bone, Terry's spine. And it was filled with all this decayed tissue from her failed skin grafts. It really was too big to treat, and it would have to heal on its own. And I couldn't imagine how Terry would survive all the infections she would get. It wouldn't work for me to give her antibiotics prophylactically, and I had nothing left in my little black bag. So I went back to my office, and I sat down at my desk, and I looked at this plant that a patient had given me years before, which had now grown all over the wall. And I thought, this bed sore is a catastrophe, and probably the end of Terry Becker. And then I asked myself, what would Hildegard do? I thought about verititos and this idea that coursing through Terry's body was this invisible power of life and healing. And I thought, Maybe Hildegard wouldn't do anything at all. Maybe she would just remove what was in the way of verititos. So I asked myself, what was in the way? Well, all the dead tissue was in the way, and it had to be removed. Anything uncomfortable that attracted Terry's attention, like a wrinkled bedclothes or a hard mattress, had to be removed. Any medications she didn't absolutely need. Fear, uncertainty, hopelessness. Then I thought, then Hildegard would fortify Terry's verititos with the basics. Good food, fresh air, deep sleep, and sunlight. So that's what I did. And it was amazing to see how fast that Hildegard's prescription began to work. But then the first of the month rolled around, and Mike showed up. He was still pretty cute. He was still wearing his tight Levi's and still walking with his little strut. The nurses made him wait in the waiting room, and we all watched as Terry wheeled herself on her prone gurney the length of the ward and went in to meet him. They were in there a long time. Finally, the door opened, and Mike came out and left. Terry had thrown him out. She told him never to come back. After that, she stopped smoking, and her appetite came back, and that hole in her backside began to fill in. Since I only examined it once a week, its healing seemed as magical to me as those time-lapse movies where a plant grows from a seed, in a few minutes. First, the base at the bottom began to glisten, and then muscle appeared, and then fat, and then subcutaneous tissue. And then the skin, all this while, is beginning to crawl in, and so the bed sore got smaller and smaller and shallower until it looked like a huge scab on Terry's back. And then that scab began to flake off, and there was new, perfect Terry skin underneath. It took a long time. It took 2.5 years. But she was in no hurry, and neither were we. And at the end of those 2.5 years, the social work located her family, who lived in the Midwest and wanted her to live with them. And the hospital bought her a ticket and flew her out, and there she stayed and did not go back on the streets and lived for many years. Watching Terry's bedsore changed the way I practice medicine. After Terry, I not only looked at my patient with the eye of the modern doctor, stepping back and asking myself, what's wrong and how can I fix it? I also looked at my patient with the eye of Hildegard and asked myself, what's in the way of this patient's verititos, and what can I do to strengthen it? I find that both ways work well when used on the right patient at the right time. Hildegard's way is a kind of slow medicine and works best on patients with slow diseases, as opposed to the fast medicine I also use, which works so well when a patient has an appendicitis or a heart attack or even cancer, which doesn't work so well after the appendectomy, the heart attack, or the chemotherapy. But although it's easy to put these two ways, slow medicine and fast medicine, in opposition, actually I find they work best together. I think of them kind of the way my two eyes work, and to give me two different perspectives, which when merged together, give me a deep, three-dimensional view. By this time, not only the healthcare efficiency experts, but also the lawyers had discovered Laguna Honda, and they didn't much like what they saw. So they demanded that San Francisco build a new healthcare and rehabilitation facility or tear it down. There were a lot of battles, as you can imagine, and finally San Francisco agreed, and the new hospital went up, and the patients moved into it 2 years ago. And I took a sabbatical to write God's Hotel. It seems to me that in the past 20 years, the healthcare pendulum has swung from the personal to the efficient. And I've been more and more impressed by just how inefficient that efficiency is. No matter what economists do, healthcare costs keep rising, and nobody really knows why. So I thought I'd show you what happened at Laguna Honda, because this I know really well in the 20 years I was there. In the 20 years I was there, as a cost-cutting measure, the patients decreased from 1,178 to 780. The doctors decreased from 32 to 9. And the clinical staff decreased from 1,500 to 1,200. And yet the budget kept rising every year. What accounted for that? The number of administrators. As you can see, even though everything went down, the total staff stayed about the same. The difference were the number of administrators. What did all this new administration do? It's hard to know for sure, but the one thing we had more of at Laguna Honda when I left than when I got there was forms. First got there, we had 2 forms. The day before I left, I opened a chart randomly and I counted. There were 43 forms. This is the graph I made at the time. And there you can see the patients going down, the doctors going down, the total staff staying about the same, the budget going up, and this is the red line's the number of forms. And I prognosticated that if person trends continue, you can see that in 2024, the number of patients at Laguna Honda will hit 0. There will be 2 physicians, 1,400 and staff, a budget of $275 million, and an infinite number of forms. I call this doing less with more. And I don't think we can blame the administrators. They're just reacting to all the regulations raining down. But I do think that we can recognize that it's not what we meant to happen at all. What happened at Laguna Honda, at any rate, was in the interest of efficiency, we became less efficient. In the interest of putting the patient first, we had to put the real patient last. And in the interest of moving from institution to community, we ended up with more of an institution and less of a community. But there is good news, because from going around the country and seeing the reaction to my book, I'm pretty convinced that that healthcare pendulum is ready to swing back from the efficient to the personal. And if I could do one thing to give it a little push in the right direction, it would be to put inefficiency, that is, unassigned free time, back into healthcare. Because it's that free time that gives us the space to be personal, to follow our calling. And that is the most efficient healthcare of all. Thank you very much.